Oh my life, I'm back. Now the following video is going to give you all an opportunity to listen to a discussion about the health challenges that our lovely boy teddy bear is facing right now. I'd like to start off with a huge thank you to Rainbow Equine's imaging specialist Jonathan Dixon, who very kindly let me film him so that I could share the whole situation with all of Teddy Bear's supporters. For those short on time, now that I've had a little cry to myself on the 4.5 hour journey home, I'm going to attempt to summarise where we are right now. As many of you already know, earlier this year, Bear went lame and was found to have some really abnormal activity in his pastern and his fetlock. Following an MRI and CT scan over at Rainbow, he was also found to have DSLD, which is a degenerative disease in the ligaments of his hind legs. Surgery was not advised for a number of reasons, so he returned home so that we could see how well we could manage his comfort levels. And at first he did really well, but recently it became quite clear that he was becoming more and more uncomfortable. So today I took him back over to see Jonathan for further assessment. Now it appears that his body has been laying down new bone to compensate for the weaknesses. But if I understood it correctly, this new bone will be very brittle and it's making it a bigger risk that the bone will fracture now. The tiny bit of good news was that there doesn't appear to be any further deterioration in his ligaments since he was there in February. So today, Jonathan's performed a bone biopsy to check for cancer in the bone. This is extremely rare, but it needs to be ruled out. If the biopsy shows cancer, Bear will be laid to rest peacefully in the orchard back at home, and we should know this within a week. If there's no cancer, we have two options. We could bring Bear home to enjoy some time with us before we lay him to rest, as we don't want to be forced into a sudden decision to do this if or when his leg fractures, which it would do. Or we consider putting him through very, very high risk and complex surgery that could result in him having to be put to sleep away from home, or best case, it could stabilise his leg and extend his life for many more years. Bear's enjoyed a wonderful time since February and has become known as our yard dog, vehicle inspector, our meter and greeter. And because he's got such a gentle nature, it's really suited him having a quiet retirement. We'll have the results of the biopsy in a week, and then we really will face a moral dilemma. Is it right to put Bear through the high-risk surgery? Is it right to ask his supporters, all of you, to fund this, especially at a time when we're already trying to improve our facilities for all the sanctuary residents and looking at what we can do to help others that may be in need? By the very nature of what we do, there are always going to be horses with health issues, but Bear's case is complex and it is unusual. We've been in this situation before with Hannes, and we were extremely fortunate with him because he overcame a very rare eye cancer and now continues to live a happy, healthy life at the farm. So please, if you have time, do watch this video. Please feel free to share your comments as always. Ultimately, my decision is going to be based on my instinct and on what Jonathan advises following the results of the biopsy. I will, of course, keep you all updated, but before I go any further, I do want to let you know that I will be removing the deadline on our 110k campaign fundraiser. It will continue to run as we must improve our facilities before the winter, but my immediate focus has to be on Bear. So, as always, thank you for your continued support, all your words of kindness and support. Your support and generosity means the world to us all and all the horses at the sanctuary. So thank you as always for watching, and I'll be back soon with more updates. We've arrived, haven't we, Teddy Bear? So we've just gone, checked you in, got your little tags to put on you. He's travelled really well, so he's not sweaty. He's looking a little confused, but we'll see Jonathan in a minute and find out what's going on. Teddy Bear's gone in with Jonathan and Heather, the veterinary nurse who was leading him there, and they're going to do some x-rays and some ultrasound just to see what the changes are since he was up here in February. We've of course talked about the pros and cons of doing any form of surgery, but until he's assessed him again, we obviously can't make a decision on what the next step must be. But we've got Jonathan here who has been looking at Bear today, and you're very kindly going to give us a summary of the situation, because it's certainly not straightforward at all. So can you just give me a summary of what you've seen today and how it compares to how he was when you saw him in February?
Yeah, sure. So what we've seen when we've looked at Bear from a lameness perspective is that we've got a worsening of that left hind leg lameness. We've got more swelling around the fetlock joint level, and when we're sort of assessing how he's standing, his fetlocks are sinking a little bit lower in both hind legs than ideally we'd like to see. And we know that that's in part related to what's going on in his fetlock joint, and also what's going on in his suspensory ligaments that are supporting the back of the fetlock. So we've done some more imaging today, some x-rays and an ultrasound of that sort of fetlock and suspensory region. And what that's shown us is that the suspensory ligaments are to some degree holding their own. There's quite a lot of sort of damage and loss of support there, but that's very similar to how it looked 3 to 4 months ago. But when we've done the x-rays of the sort of fetlock joints and the pastern region, these kind of dark shadows, these sort of cystic cavities within the long pastern bone are more prominent, and we're starting to see progressive bone forming around the outside of the long pastern bone. Here is, I'll just move the mouse out of the way, so we've got the bottom of the cannon bone here. These are the sesamoid bones on the back of the fetlock, and this is our fetlock joint. This is the long pastern bone and the short pastern bone. And with Bear, we've got these very dark shadows here within the centre of the long pastern bone, kind of coming throughout this whole region. We've actually got a couple of additional ones down in the short pastern bone right here. Compared with his previous x-rays, we've got a whole lot more roughened bone along the surface on the front and on the back here of the long pastern bone. And when we look in an x-ray that's taken from front to back, we see all of this change now down the outside and the inside. And again, we see these dark cavity areas here within the bone. That's progressive and become certainly much more evident since the last x-rays a few months ago. What we also see is that the sort of central portion around these sort of dark areas, this kind of other portion of the pastern bone has become much denser, much whiter, and that's the body's response to try and support that bone a little bit more. And then we can also see the soft tissue swelling here on the outside and the inside, and this is swelling associated with the fetlock joint, and it's also swelling associated with the suspensory ligament branches that are attaching on the outside and inside of the sesamoid bones right here. So overall, the soft tissue component of what we're seeing in this region seems quite stable. It's causing a component of his lameness for certain, and it has an effect, a second effect on his other leg. But what we're more evidently seeing is that the bony changes have deteriorated. They've progressed over the last sort of 3 months or so. And that gives us the concern about maybe what we need to do next.
So there's a risk with the way that the bone is there that it could just suddenly fracture.
Yeah.
Because of the weakness in the middle there. But at this stage, we don't know whether there's a tumour in the bone, but obviously there's the risk, as you mentioned, of doing a biopsy now could cause more weakness in that bone, that it could again fracture.
Yeah, we've got areas down the sort of middle of that bone where we've definitely got areas of true weakness because the bone has been sort of resorbed or sucked away by these kind of cavity areas forming, and what's not clear from an x-ray or from the outside, unfortunately, is what's going on inside that bone, if that is a cyst-like lesion or multiple cyst-like lesions that are more of a benign process, or if that's a more aggressive process, especially given the change over a short period of time, something like a bony cancer. So the biopsy that we are considering and talking about today will be to try and get a little sample from the centre of that bone. It does carry some risk because we'd have to drill a hole into that bone within nerve blocks, so you can't obviously feel that area at all. To try and get a sample out of the centre and have a look at that with the pathologists under a microscope and see what the cells in there are doing. And that might tell us very clearly it's either a more benign process or a more cancer type process. But sometimes those biopsies can be a little bit sat in the middle if we don't quite get exactly the right cells, and we don't want to be drilling lots and lots of holes in that bone for the reason you mentioned, it become, cause of weakness. And I guess that leads on to maybe potential treatment options and factoring in that idea of a biopsy with what we might be able to do here to try and support this fetlock, which of course the bones are certainly in need of as they've deteriorated.
But cancer is a very rare thing in the bone in horses, but being a Friesian as well, they like to have unusual things.
They do like to have unusual things going on. Primary bone tumours in the legs of horses in particular, but in any sort of part of the bone of horses, are really uncommon. But they do happen, and various types of tumours are definitely sort of reported, and things that we have to be aware of. And that's one of the big reasons why we sort of want to think about a biopsy before undertaking any sort of really significant surgery, to be really mindful of his welfare. If that was to be positive for some sort of cancer, it might really suggest that surgery is not going to help him, and if that tells us it's very clearly a benign process, then we can potentially think about more invasive options that might support that leg a little bit more.
Yeah, and this is the hardest thing that Jonathan and I have been talking about, is what's the right thing to do primarily for his welfare, because putting him through the surgery that we've talked about is a massive risk, isn't it?
Yeah. So the surgery that we've talked about a little bit is a surgery to completely fuse the fetlock joint and also the pastern joint with a big long metal plate down the front of the cannon and all the way down the pastern. A metal plate coming all the way down from the front of the cannon over the front of the fetlock, all the way down over the front of the top of the pastern bone, with screws going through here to support and stabilise and fix that fetlock joint and also that pastern joint in place. And additionally, some screws that would go through the bottom here of the cannon into these sesamoid bones to anchor those in position as well. Of course, these screws would have to be coming through the bone, and that involves these areas of sort of bone resorption, which are potentially weakened areas right down this central portion here of the long pastern bone. And we're very mindful of the risks associated with drilling holes in that region to place screws could ultimately cause some further deterioration. However,
and it could cause it to fracture during surgery, couldn't it?
Yeah, and that's a really big reason why we've spent a lot of time discussing what's in his best interests, and from a welfare perspective, is this the best option that we've got? But what's become clear is that he's sadly on a bit of a downward trend with his comfort at the moment. We've tried the various conservative options that we have available, and they haven't sort of resulted in him getting more comfortable. We've given it a good period of time, and we're seeing the progression in the bony changes, and that's the frustrating sort of situation we're in at the moment, isn't it?
Yeah, and the long and short of it is if we don't do anything, we're going to lose him. We're potentially going to lose him even if we go through surgery, but we're giving him that opportunity. But it's an incredibly complex procedure to go through, not just the procedure itself, but also the aftercare and what you'd have to do to manage him getting through.
Yeah, exactly. I think that first of all, the biopsy has risks, as we've discussed, in terms of potentially weakening that bone or not necessarily giving us a complete answer. Secondly, any sort of surgery that we're talking about is clearly a really huge undertaking. There's a lot of complexity involved in the actual procedure, but it's additionally made complicated by these areas in the bone here that are structurally going to be weaker than ideally we would like them to be. But we probably can't change that. We've got the situation that's in front of us, and we've got to deal with that one. Aftercare wise, certainly we have risks in surgery of that bone breaking in recovery, the same thing happening. And like with any surgical procedure, we have risks of infection and cast or bandage rubs and sores that could complicate matters down the line. And certainly his care would be, quite intensive for quite a period of time, maybe some weeks in hospital for certain, and then a lot of care in TLC at home if all were to go well.
Yeah, I mean, if we were to go down this route and all the plates went in place and he came through the surgery fine and he was able to come home, what are we talking in terms of how stable that leg would be now? I know you can't give complete answers at all, but
in an ideal world, that metal construct of the plate and all of the extra screws and things like that would be supporting that region from the mid-cannon all the way down to the bottom of the pastern, and that would be then taking a lot of the weight through that abnormal segment in the middle and distributing it out through the plate and down back through the rest of the foot. And if that works, and if that is effective for him, and we don't get any complications on the way, which is a significant possibility, both in his abnormal leg here and also the other leg that's taking a lot of extra weight at the moment, then potentially, that could lead to him having a much improved comfort to start with, and horses with that sort of process and with that surgery can be happily and retired to feel turn out and be super comfortable. If that goes well.
Yes, okay, yeah. What Jonathan and I have agreed today is that I think the first step has to be to do this biopsy, because if there is cancer in the bone, then we know that we need to call it a day with him, in which case he'll come back home. Obviously don't want to have to make that decision, but if it's the right thing for him, then that's obviously what we'll do. The next dilemma is knowing whether it's right to put him through this, and I think I can't make that decision 100% until we've done the biopsy. But as you've said to me, we need to order the plates in because of the timescales involved in this. If you could...
Yeah, so I think we're mindful that the lameness is getting worse and the swelling is getting worse. The bone is looking visually significantly worse than it did only a couple of months ago. And there's a risk that obviously as each day, week, month passes, that could potentially just weaken on its own and result in something like a fracture developing that we can't then repair. So we're mindful of the timeline. We've tried all of the conservative routes and they haven't helped us, but I think at this stage, getting the biopsy is job number one. If we're going to be going potentially down the route of surgery after that, given that the implants used here are really specialised bits of equipment, we need to think about getting that ordered if we can, so it's ready to use for him, should that be the decision that ultimately together we take and we feel is the right thing for him ethically, morally, and putting his welfare top of the list, which is absolutely where I think we all stand, isn't it?
Absolutely, because I think that the timescale is if the biopsy's done and we want to go ahead with the operation, then we don't want a long period of time between the biopsy and the operation happening, and obviously I don't want to be taking him on that 4.5-hour journey home to then bring him back again. So that's why we need to order the plates in, just in case, but then we have to look, obviously, as is always the case with any of these things, at the cost of it, and it's knowing A, whether it's right for his welfare, but B, whether it's right for me to then reach out to all of you, all of his supporters, to actually ask you to fund something that is very high risk anyway. And we've talked briefly about the costings for this. And
yeah, I mean, undoubtedly, should this biopsy not give us an indication of cancer, and should it be that with a lot of thought and a lot of discussion together as a hospital, group of clinicians and yourself, we feel that surgery is the right option for him, understanding those really, really big risks involved, then it's a really huge undertaking for him and obviously for the team. And the costs are going to be significant. He's likely to be hospitalised for a significant number of weeks. The surgery itself is very complicated and technically demanding, and requires a lot of expensive equipment in its own right. And then he's going to need a lot of TLC and hospitalised care afterwards, and that's likely to come at quite a significant cost.
So you were talking in the region of about £10,000.
I think that's a not at all unreasonable estimate of where we could be, potentially, without significant complications as well, which are a possibility, and stumbling blocks along the way could happen.
Yeah. So right now we're going to go ahead with the biopsy. I'm going to have to think about this. I'm going to obviously put this out to all of you. There's going to be varying thoughts about it. But yeah, I'll need to sleep on it. We'll need to see what the biopsy says, and I'm not going to make any decisions on it today. I will certainly be led by Jonathan and his team, because I know when he came last time, you all were very clear that you didn't think it was right at that time to do a surgery. And I completely respected that. It's going to take about a week to get the results back.
Probably 5 to 7 days I would expect that we will have some results from the biopsy, due to the process that the kind of burn samples have to go through to be sort of analysed by the pathologist. So we'll get that process started straight away. As soon as we've got any results back, we'll be obviously in touch, and we'll look after him here in the hospital in the meantime. Make sure he's nice and comfortable, lots of TLC and cuddles, and then we'll go from there. You very much feel this should be one step at a time. His welfare is the absolute most important priority for us as well as you, and as we talked about, that was the reason why we didn't want to do something sort of invasive at the last time we saw him.
So Teddy Bear is going to be staying here now for the next week at least, and then we'll make a decision as soon as we've got the results. But I'm just going to stop with the little man for a bit and give him some cuddles and loving before I have to leave him here. You Teddy Bear.